Namaskar. Welcome to Kovai Post. Welcome you all to create an awareness and also to know about the stroke. So nowadays we could find lots and lot of people being affected by stroke. And today we are here to know more about it. More than 1.8 million of people in India has been affected by stroke. And today we are here to know more about it. And our initiative, Stroke P Rock, is to create some awareness and also to cultivate more understanding about stroke. Today, here, Doctor has been joined along with us to create more awareness and also to know about the advancement of science in India. Welcome, sir.
Thank you.
So, what is a stroke, sir?
So, before coming to stroke, so let us do some basic discussion. So, we know brain is the master organ of our body. So, suppose we are moving our hand, suppose moving our left hand, then the signal is coming from the right side of your brain. Suppose we are talking, suppose today we ate food, we came to hospital, we are speaking. This is because our brain is functioning normally. So, there are different areas of brain which controls different parts of our body. There is a center which controls our speech, there is a center which controls our leg. So, if something happens to that part of the brain, then we cannot do these activities. So, stroke is basically a disorder of the brain, sudden neurological deficit we say. So, it is a neurovascular disease. For brain to work 24/7, we need to supply glucose and oxygen. That means the brain has to get continuous blood supply to function. Suppose for any reason there is a block, sudden block in part of the brain blood supply, then those area of brain will die. So, the cells of brain we call as neurons, and these neurons, if they die, they will manifest as symptoms. So, that we call as stroke. So, many people know if there is a blood supply, there is sudden stop of blood supply to heart, we call it heart attack. So, similarly, if there is a sudden either a block or a bleed inside the brain, we call it as brain attack. So, it is very important to know the symptoms and signs of stroke so that we can take immediate action.
Okay, sir. So, can you tell us what are the different types of stroke?
Yeah. So, we divide stroke into two types. One is called ischemic stroke and another is called hemorrhagic stroke. In ischemic stroke, there are pipes, blood vessels we say. So, this blood vessel supplies the glucose and oxygen to the neurons. Suppose there is a sudden blockage, those things we will discuss later, what are the causes, how it can happen. Suppose there is a sudden blockage in one of the blood vessel, that we call it ischemic stroke. Ischemia means lack of blood supply, lack of oxygen, lack of glucose to that part of brain. And another is called hemorrhagic stroke. These blood vessels which is there inside the brain parenchyma as well as on the surface of the brain, it may rupture. There are many reasons why it can rupture. If it ruptures, we call it as hemorrhagic stroke. So, almost 2/3 whatever we are seeing in our routine practice, in our emergencies, in our OPDs, more than 70%, almost 80% of patients they suffer from ischemic stroke. That means because of blockage to the blood vessel, and rest 20% is because of hemorrhage, bleeding in the brain. We call it as hemorrhagic stroke.
So, okay, so then what are the warning signs? How could we find earlier that we have stroke?
Okay. So, basically it is very easy, very simple. So, most commonly they presented with one side, always they will say, suppose there is a blockage in the right side of brain, they will say there is like they cannot move the left side of their body. So, left side leg they cannot lift, left side hand they cannot use, and sometimes they will say numbness depending on the which area of brain is getting affected. Suppose the area which controls the speech gets affected, then the patient suddenly will become mute, or we cannot comprehend, we cannot understand what they want to say or what they are saying, incomprehensible sound they may produce. Sometimes that will cause dysarthria. So they will say something, but we cannot understand. So depending on which area of brain is getting affected, symptoms will vary. So most commonly there is an we say B fast. B is, this is a mnemonic you can remember for general public. So B is balance, loss of balance. Suppose the stroke happens to the posterior part of brain, we call posterior circulation stroke. So that controls our walking. Walking, they cannot walk in a straight line, and that will cause loss of balance. Then E, E for eye, sudden loss of vision. So the eye is the blood supply also comes from the carotids. So if there is some block in the blood supply which supplies to the eye, that can cause vision loss, blindness. Then comes your F for face. So there will be, if you ask the patient to say E or to show their teeth, you can see the face is getting deviated to one side. Then the arm, like you ask them to lift there, they cannot lift. Then here comes speech. So if these things are there, then it's time to call to emergency and time to come to emergency. Because if you delay, because each minute we delay, 2 million neurons in the brain, they die. So these are the simple signs. Anyone can detect stroke if they suspect stroke, because stroke patient cannot come to hospital directly. Someone has to take them. So if you suspect, you should come immediately to a hospital which is ready to do all the treatment for stroke. So these are the signs and symptoms of stroke.
So how do you diagnose a stroke, sir?
Okay, so with these symptoms, when patient comes to us, we do a quick examination. So like all these things what I said before, we try to find out what is the power, what is his consciousness. Sometimes massive bleed or massive stroke, patient may lose consciousness. Sometimes they come to hospital comatose condition. So once we clinically suspect stroke, then we do some basic tests like CT scan brain or MRI brain. So in CT scan and MRI we can diagnose whether stroke is there or not. So once it is there, then we confirm yes it is stroke. Then we do other imagings also like angiogram, CT angiogram, MRI angiogram, and certain simple blood test like serum sodium and glucose, because sometimes hypoglycemia, if sugar level is low in the blood, it can mimic a stroke, and also sodium. So these are the basic tests we do in our hospital. So once stroke patient comes, a doctor sees the patient, and if we clinically suspect stroke, then immediately we shift the patient without wasting time. So this imaging and all we finish within 15 to 20 minutes. So once everything is done, we diagnose stroke, we confirm stroke, then we proceed for treatment.
Fine, sir. So what are the treatment options for stroke, sir?
Yeah. So this treatment, the stroke treatment is evolving, because before we think, or we used to say, if neurons are dead, if blood supply to brain is cut off for some time, the neurons are dead, then whatever we do, we won't, the neurons won't recover. But the concept is changing. Now what we know, what science is telling us, if there is stoppage of blood supply to part of brain, not all the neurons they die. Some neurons they die. Those neurons we cannot revert it back to normal functions. These neurons are called core of the brain. Surrounding these damaged neurons, there are certain neurons, certain cells which are still viable. Viable means they are ischemic but not infarcted. They are not dead. So if you establish the blood supply to that part of brain, the neurons will recover. The recovery become faster. So we call it as revascularization therapy or reperfusion therapy. So there are two methods to do this treatment. One is IV thrombolysis. If the patient comes to hospital within 4.5 hours, we give a injection through the vein, that we do in emergency, and that helps in establishing the blood flow to that part of brain which was blocked earlier. So if you give the thrombolytics, if it dissolves the clot inside the brain, neurons again start getting blood supply, and again they will start functioning. So the patient which was not moving, they will start moving the legs. Those who are not talking, they will start talking. Some recover early, some take some time, some recover after some months. So recovery depends how much damage already done to the brain. And another, which is the latest one, we call mechanical thrombectomy. Here, if the clot is big inside the blood vessel of the brain, then we take small catheters through the thighs, groin, we go inside the brain and we suck the clot out, or we use a stent retriever and pull the clot out. So, if you remove the clot like in your blood supply in the water pipe, suppose there is a block in your kitchen, there is a blockage in the pipe, the plumber comes and cleans and again water starts flowing. Same thing for brain. If there is a clot, we go there, we clean it, then again the brain gets blood supply. So, once blood supply starts, the neurons starts recovering and the functionality, the recovery of the patient become faster. So, these are the two treatment modalities for acute ischemic stroke, and for bleeding we have different set of treatment. Suppose the bleeding is large, then the neurosurgeons, they open the skull, they remove the clot, and there is another special type of bleed, we call it a subarachnoid hemorrhage, which happens on the surface of the brain. There, if there is some aneurysms are there, then we go and do the coiling. So, these are the different treatment modalities of stroke.
So, what is the impact of stroke in our day-to-day lives, sir?
Yeah. So, stroke is a very bad disease, very devastating, not only to the patient, but to the family, to the society. Suppose before we used to see strokes above 60, above the age of 60. Nowadays, it is happening above the age of 40. Lot of stroke patients in their productive years. So, this 40 to 60 years, which is the most productive years, we see stroke happening in those group of people. So, if it stroke happens, so they not only, sometimes if it is a major stroke, they may lose their job. So, they become burden to the family, and they cannot do their activity by themselves. Even for, suppose their right side hand is paralyzed, they cannot eat, they cannot take care of themselves, they cannot go to bathroom, they cannot drive, they cannot ride a vehicle. So, personal level, and stroke is a depressing condition. So, once stroke happens, the patient becomes depressed, because all the activities, the daily life, everything gets affected. Their social circle, their friend circle, everything gets affected by stroke. So, if they come to a hospital where there is all facilities starting from reperfusion therapy, mechanical thrombectomy, rehab, and secondary prevention, physio, occupation. So, there are many methods which we apply to make them functionally independent. Short term, yes, they need hospital care, long term they need rehab therapy, and the role of family, role of society is huge in stroke patients, because someone has to take care of them, take care of the stroke patients financially, emotionally and physically.
What is the lifetime changes which can reduce the stroke, sir?
Yeah, stroke we can say is a lifestyle disease, we can put in that way. We used to say heart attack. If you take a lot of junk food, if you are not doing exercise, if you are smoking, if you are obese, your weight is very high. If you are diabetic and you are not taking medications, diabetes is not under control, your cholesterol level is high, your blood pressure is high and you have not checked, or you are not taking medicine properly, then yes, you can have a stroke. So, 2/3 of patients we can prevent stroke if you take proper medication, if you take care of yourself properly, if you have an active life, you are not smoking, if you are taking healthy foods, vegetables, fruits, you are not smoking, you are not taking alcohol, you are doing exercise. So, 75% chance you won't get a stroke, but there are certain factors we say non modifiable, it is not under your control. Like suppose your parents got stroke, both the parents, then there is a high chance that you may get a stroke. And elderly population, so age is also a risk factor. Above 60, our blood vessels starts hardening, we call atherosclerosis, the plaques develops, because that is the natural history of life. So somewhere our blood vessels also they undergo aging. So atherosclerosis will develop, blocks will develop, so that can also cause stroke. So those things is not in under our control. But if you have a healthy lifestyle, you don't smoke, you have adequate sleep, 6 to 8 hours of sleep, stress, you don't take much stress, then most of the time you may not get a stroke.
So October 29, World Stroke Day. So what about you, sir? Just tell us about the significance of having World Stroke Day.
Yeah, stroke is so common. I think we definitely need a day to make people aware and to make people know that there is a treatment for this, to make people know that you can prevent this. As per WHO, stroke is one of the leading cause of death. So, in Western population, in Indian population, in Asian population, it is maybe number 2 or number 3 cause of death worldwide. And if you see the disability, the disease which can make people disabled, stroke is the most common cause. So, such a high impact disease, family wise, personally wise, social wise, we should spend a day, we should mark a day so that we can do some activity. All over world people will be doing some activities, lot of hospitals, lot of organizations, WHO, World Stroke Organizations, they will be doing awareness, because that is the way to go ahead. Because if you can make the people aware, so first thing is we should stop stroke happening. If it doesn't happen, that is good for the people, good for the society, good for the family. But if, as I said, there are certain things we cannot control, and especially those who are having cardiac diseases like valve disease, like arrhythmias, so they can have stroke. So they have to control their cardiac things. They should take proper medications as prescribed by neurologist and cardiologist, so that they won't get a stroke. So this World Stroke Day, we need to emphasize that stroke is preventable. You try maximum, maintain healthy body weight, do exercise, don't smoke. In spite of that, you are getting stroke, we are there. You come to a hospital. Our hospital, GKNM, is the first advanced stroke center in Coimbatore. We have 24/7 service, we have emergency service, we have CT scan MRI service, we do thrombolysis, IV thrombolysis, we do mechanical thrombectomy, we have special cath lab for that. Only for stroke patient we have a cath lab, where we are a postgraduate department. We have doctors 24/7 to do thrombectomy, and after that we have speech therapy, because as I said, some people may recover completely, some will have residual deficits, residual paralysis, residual speech problem. For them we have speech therapy, we have language therapist, we have physiotherapy, rehab center, comprehensive rehab center to make them functionally independent. And we have psychologist, because most of these patients will be depressed, so we need to counsel them properly and counsel the family members who are going to take care of the patient. So I think yes, we should observe, we should celebrate, and importantly, and this media, social medias, print medias, and they have a huge role to play, because they have to convey our message to the public in layman language, so that they will understand what not to do and what to do if you get a stroke. That is also very, very important. If you are getting a stroke, you are wasting time at home, giving water, giving sugar. We have seen patients, they wait at home, giving sugar, giving water, calling different people. By that time we are wasting time. So if you waste time, your recovery will become like it will take time. So if you come to hospital early, to a hospital which is well equipped with 24/7 stroke service, chance of recovery will be better.
So what is the message you're going to give for our viewers, sir?
Yeah. So this year we have every minute counts. The WHO, World Stroke Organization, they gave this. What I will say, my message will be, don't be afraid of stroke. If it happens, there is treatment, and try to have a lifestyle so that you won't get a stroke. So these are the two things: be active, avoid stroke. If it happens, come immediately to a hospital because every minute counts. Thank you.
Thank you for your valuable time, sir.